Dr. Christopher Bromley, who is a podiatrist, and he practices in New York.
We're here to talk a little bit from my perspective about how we changed our practice. I'm in New York. We have a 70-physician multi-specialty, many podiatrists, and we were having the same troubles navigating patients. We didn't have someone like Lorie, so there was a lot of wasted time, a lot of miscommunication, and I discovered CarePICS last year, which is an app that has 4 pieces to it. So on the screen, you'll see that there's a report function. In our practice for many years, when we would document wounds, we did what everybody did, where we would take a picture and we would have a ruler, and hopefully those pictures and hopefully those measurements ended up in the chart. And we all would admit that it eventually, hopefully did. But the advantage of using CarePICS is it allows me to take an image of the wound, measure very simple on the picture, and then I can move that measurement and that image right into the chart. And more importantly, if I need to consult my colleagues like yourself, I don't have to get up out of my chair, write a prescription, give it to somebody like Lorie, have her then get it to you. Maybe the patient would get there. So then what we do after we've done the report, we use the consult piece. So with the tap of my thumb, we use CarePICS to send that patient directly to you. HIPAA compliant way, no wasted time, instant referral. As soon as you and your team gets that, you can consult me back that I know that you got it. When you've taken care of the patient, then as part of the reporting process, you can send me back the images of what you did. So everybody is together working on the same image, the same measurements, the same patient. So CarePICS is really that connective tissue that we work together, that makes our jobs easier and makes the level of care much better, and we're going to get those outcomes and prevent amputations, which is why we're here. There's two other pieces. One is, one of the things that came out of COVID was that the need for telehealth became very apparent because we weren't able to get patients in. We were closed down in New York for quite a long time. So there is a virtual health piece of CarePICS that allows you, no matter where you are, it could be a Saturday or a Sunday or an evening, you can always use CarePICS to do that consultation with a family member or the patient. Patient can use the app to send us pictures so the patients can report how the wound is doing when they're unable to get in. And the last piece is the order piece. So every patient that we're treating for wounds needs some sort of dressing, whether it's wet, dry, needs a biologics. We can use the order piece to basically, with the tap of my thumb, order whatever I need. It gets shipped to the patient. So those 4 pieces, the reporting piece makes my job easier because I don't have to remember the measurements. I don't have to look for the pictures. It automatically gets imported into my EMR. I can then coordinate care using consult, which makes the patient level of care better. You and I can communicate the old way. We had pictures on our phone, right? Right. And mixed in with our kids and the pets.
That's right.
And we had text messages back and forth, which we know now because of the rules of HIPAA are not the best thing to have on our phone. So the advantage of CarePICS is everything's encrypted. We don't have to have pictures mixed in with our family. Everything is stored on the web, so there's no risk from a HIPAA compliance perspective, and it coordinates our care with each other quicker. We can communicate back and forth. The patients love it. When I have a patient download CarePICS, when they're in the room, first visit, I explain to them, you have now 24 hours, 7-day-a-week concierge wound care. And the patients are blown away. They're like, what? I'm like, yeah, you can communicate with me anytime you need to, and we can communicate. The patient can send me images. I'm not giving my cell phone out anymore. Patients can communicate with me in a safe way. So that's how we use CarePICS, those 4 features. This is what it looks like. So if you look at the images, you'll see here one of my patients. This is a diabetic with a Charcot. They've got a breakdown. You see a little green dot. For those of you that don't know CarePICS, when we take a picture, the green dot is the reference. It measures 1.9 centimeters, and the calculation of the wound measurement is done automatically off of this photograph. So we take a picture, circle the wound with our finger. That creates the measurements you'll see on the right side where it says chart. And then, in addition to these measurements, which have revolutionized the way that I document, we can also track the wound. We know that wounds get better, sometimes they get worse. What we're doing with CarePICS is we're trending the wound, and you can see on the bottom right the trend of how this wound is doing. And this represents what a typical diabetic will go through. They'll get better, they'll get worse, they'll get better, they get worse. But what we're trying to do with CarePICS is elevate the level of care. So when you see something like this, when you see a wound not getting better or a wound getting worse with that big spike, we can then use the consult feature to communicate with each other.
Right.
On the first visit, I should have been sending the patient to you for evaluation.
Right.
Maybe you did a revascularization, you sent me the images back, but if I see a spike like this is a warning sign. It's very, very easy to see. This is a patient where I send this patient back to you and say, hey, Dr. Raja, what do you think about this? This is what the wound looked like. You can see all the pictures. You and I are looking at all the same images. We're looking at these trends, and someone like Lorie can help facilitate that, but that's a patient we need to have another look at. So
another thing is that you can have objectively, you can see that comparing the wound, is it better or worse? In my practice, one of the issues is that once we know a podiatrist or wound care physician thinks the wound is not better, by the time I see them and arrange for revascularization, it might be a week or maybe longer because the communication didn't happen.
right.
I think this is, this should have been done a long time ago.
Yeah.
Why didn't anybody think of that? But I'm glad somebody did.
Yeah.
You guys did.
Yeah.
So it definitely helps to get the care to the patient as quickly as possible.
Right, it's that connective tissue between you and I, and our teams are now connected. We're in different offices.
Right.
We can be in different parts of the state, but because we're all looking at the same images and the same objective data, we can make good judgment and good decisions about how we want to manage this patient, and we can work together as a team. And that's what's going to give us the outcomes and save lives and save limbs.